know, we represent some of the states that are hardest hit in the country by the epidemic. New Hampshire is second only to West Virginia in terms of the percentage of overdose deaths in the country. Last October, President Trump stood on a stage in Portsmouth when he was campaigning for president, and he declared that if he were elected president, his administration, and now I'm quoting, will help all of those people so seriously addicted, we'll get them assistance, we'll make sure they have the top treatment and get better, end quote. He repeated those promises whenever he was in New Hampshire, a number of times throughout the general election. But unfortunately, we're 4 months into this new administration, and so far, President Trump has only put forward policies that would be enormous setbacks to state and local efforts to turn the tide of this crisis. And the greatest threat that we're seeing comes from the so-called American Health Care Act that was passed by the House. This is legislation that decimates Medicaid expansion and gets rid of the requirement that insurance plans cover substance misuse treatment. So it would essentially take a wrecking ball to all of the efforts to address treatment for the opioid epidemic in New Hampshire. The two parts of the Affordable Care Act that have been most successful in helping us address this epidemic are that expansion of Medicaid that provide coverage for people with substance use disorders, and the requirement that mental health treatment has parity with other diseases. Now, this couldn't come at a worse time for us in New Hampshire, where we had a 9% increase in opioid overdose deaths last year, and we're beginning to see deaths from carfentanil, a drug that is 100 times more powerful than fentanyl, than heroin. With the emergence of carfentanil, we could potentially see the beginnings of a new, even more tragic chapter in this epidemic. It would turn back the progress that we've made. Now, as I said, I'm delighted to have my colleagues here because everyone here has been working equally hard to address this epidemic. But before I turn the podium over to Senator Whitehouse, I want to just point out that the other concern I have with what's being proposed by this administration is the dramatic cuts to both the high-intensity drug trafficking area program and the Drug-Free Communities Grant Program, which are both part of the ONDCP. These are critical tools that states like New Hampshire are using to make a difference. And what this administration is doing is proposing dramatic cuts, maybe even elimination of that ONDCP office. So that's why Senator Hassan and I are introducing legislation today to protect the office, to reauthorize it for 5 years. Our bill, I think, is very important as we look at the programs that are operated out of what is known as the Drug Czar's office to help states like New Hampshire. So thank you all, and Senator Whitehouse.
Right behind you.
Good.
Thank you all for being here. Thank you very much to Senator Shaheen for organizing this. Senator Shaheen and Senator Hassan in New Hampshire see this really up close, as do my other colleagues. We hear a lot from Senator Manchin about what's going on in West Virginia. In 2015, the year that we were finalizing the CARA bill, 258 people died in Little Rhode Island from opioid overdoses. In the first quarter of that year, one little town in Rhode Island, Burrillville, Rhode Island, a rural town up in our northwest corner, lost 6 people just in that first quarter. Over and over again, those same funeral parlors, those same police officers, those same EMTs had to respond to tragedy after tragedy after tragedy in that one little community. And we responded with the CARA bill, which passed with huge majorities. And we counted in large part on the infrastructure that had been put in place by Obamacare to fund treatment for people when they needed it. Whether they got it through the Medicaid expansion or whether they got it through required benefits under Obamacare that they got through the exchanges, this really helped. So the Republican attack on Obamacare absolutely turned its back on the opioid epidemic, and we need to turn that back around. They need to come back to being serious about this. It's not enough to have dog and pony shows with Governor Christie and have a discussion group. You got to actually get the treatment to the people who have the addiction, period, and end of story. And to come after this now and try to undo the Office of National Drug Control Policy, the ONDCP, in this environment is virtually insane. That is a valuable tool that can be used to help. Even the more law enforcement directed parts of ONDCP, like the HIDA program, can be used to attack the flow of illegal fentanyl that is coming in and feeding into this epidemic. Primarily, it appears, from China, but these high-intensity drug trafficking area programs are exactly the kind of thing to help get to the bottom of this. So the proposed cuts to ONDCP and the proposed cuts to HIDA also make no sense. All we're asking is that this administration follow the direction and the promises that this president actually made to people in states where they are suffering from this epidemic, and try to honor what they said they would do instead of yet again backing off and going in the opposite direction from Trump promises. Thank you. Next is Senator Joe Manchin.
First of all, thanks, Jeanne, and thank all of my colleagues for being here, because we all have the same problem. This is not a Republican or Democrat problem at all. It's an American problem. Any other situation such as this, any other type of a disease such as this, it would be a pandemic, and we should be treating it as such. It's callous to say that you're going to cut back on people for the first time being able to get treatment, or being people basically get mental illness, get treatment. It's just absolutely unconscionable. And in West Virginia, we've been hit harder than any state in the nation. Our state did a lot of heavy lifting. We do the mining, manufacturing. We've done a lot of heavy lifting. So there's a lot of people that basically are exposed to sometimes some injuries that doctors prescribe, opiates and prescription drugs that basically ruin their lives because it gets them addicted. I've only said this to many people. I said, it really doesn't care what class you come from. It doesn't care how much money you have. This is attacking everybody. And it's been a silent killer for far too long. I haven't had one Republican that I've talked to that basically doesn't know somebody, and not one Democrat. Either their immediate family, extended family, or close friend hasn't been affected. Being a silent killer, we never talked about it. We were afraid to say anything. Oh, it's my son or my daughter, it's my aunt or my uncle, it's my brother or sister. So we'll take care of it, keep it in the family, because it's too damaging. I don't want anybody to know about it. Well, guess what? They're dying right and left. Doesn't care who they are. And then have treatment for the first time. I've asked my Republican friends, we have a Lifeboat Act. A Lifeboat basically says this: we're going to charge 1 penny per milligram for every manufacturer that produces an opiate on the market. Just opiates, not other prescriptions, just opiates. And basically that 1 penny goes to treatment centers. That's $1.5 to $2 billion a year. So I don't know what avenue they're going to take. You can't just put your head in the sand and say, I'm not going to treat. I have no treatment centers. And I'll leave you with this. My cousin's a federal magistrate judge. He says, Joe, I sentence people to jail every day. Every day I sentence people to jail. He said, I've not had one person ever say, Judge, I'm sorry, you can't put that person in jail because we're out of jail beds. We have no cells left for them. We'll find a place to put a person in jail. But he says, if it happens 1 time a day, it happens 10 times a day. I'm sorry, Judge, we have no treatment centers for you to put this person in. So you know where we put him? In a jail cell. It's awful what's going on, and we're not addressing this at all. And to have a country that basically consumes 80% of all opiates produced in the world, something's happened. Less than 5% of the population of the world is in this great country of ours. How do we become so addicted? So I don't care whether you're a Republican or Democrat, you're conservative, liberal, whatever you may be, you better work with us and try to find a solution. And throwing this part of it out the window, and like the baby with the bathwater, is not the way to fix it, I can assure you. And with that, we have now Senator Baldwin from the great state of Wisconsin.
Ever since the House passed what we could call Trump Care 2.0 a little over a week ago, several of us have gathered here to talk about the impact of that bill on constituents that we represent. We've convened to talk about its impact on veterans. We've convened to talk about its impact on women. And today we convene to talk about how it impacts the challenges seen in all of our states with regard to opioid, heroin, and now fentanyl abuse. This is epidemic in the state of Wisconsin. We have seen major increases, in fact, nearly doubling of the number of overdose deaths in Wisconsin between 2006 and 2015. We know that now opioid-related death is one of the leading cause of injury deaths in the state of Wisconsin. I've had the opportunity to travel my state, convening roundtables and stakeholder groups with law enforcement, judges, people providing treatment to those suffering from substance abuse, also people in recovery, and families who have lost loved ones. Last year, we finally made some bipartisan progress in fighting the opioid epidemic. But frankly, Trump Care will pull the rug out from under our efforts, and it will bring us backwards. Unlike some of my colleagues standing here today, I hail from a state where our governor refused to expand Medicaid. We've been playing catch-up because of that for a long time. But Trump Care will make combating this crisis even worse. Specifically, Trump Care will weaken consumer protections in the private insurance market, and it repeals the guarantee that insurance companies must provide coverage for substance abuse treatment, mental health, and other essential benefits. This epidemic has been a nightmare for the families that we represent, and President Trump's proposal will prolong this nightmare with higher costs and less care for prevention, treatment, and recovery. And I next invite Senator Markey.
Thank you. We have a crisis in America. Massachusetts is a perfect example. Last year, 2,000 people died from opioid overdoses. We're 2% of America's population. If you multiplied that by 50, that would be 100,000 people. Only 33,000 people died in America last year from opioid overdoses. Last year in Massachusetts, 1,400 people of those 2,000 had fentanyl in their system. If people were dying in America at the same rate as they're dying in Massachusetts from fentanyl, that would be 70,000 people per year. So Massachusetts and New Hampshire, with their fentanyl crisis, is a preview of coming attractions. What is the response of the Republican Party? Well, the bill which passed in the House of Representatives will cut Medicaid funding by $880 billion. That is the funding mechanism to give access to addiction treatment to 2.8 million people in this country. The only way in which these people are going to avoid a catastrophic family crisis is if treatment is available. Instead, what the Republicans are doing is handing control of this issue back to the insurance industry, back to the discretion of states to determine whether or not this is, in fact, the kind of an issue that should guarantee treatment for people who need that help. That is what the Republican bill that is coming over from the House does. By cutting that funding so dramatically, by removing that guaranteed coverage, they are reducing dramatically the chance that we will have in our country to reverse this epidemic. A vision without funding is an hallucination. You cannot say, on the one hand, you care about an issue and simultaneously then slash the funding, slash the access, which makes it possible for families to gain access to the help which they need. That is why we are here. The Republicans cannot have it both ways. They cannot say they care about this issue, they agree that it's a national crisis, while simultaneously slashing the programs necessary to fight it. Let me now turn and recognize the great senator from the state of New Hampshire, Maggie Hassan.
Well, thank you, Senator Markey, and thanks to my fellow senators for their comments and advocacy this morning. As you heard from my colleagues, the heroin, fentanyl, and opioid crisis is devastating communities all across the country, and it is the most pressing public health and public safety challenge in New Hampshire. And the challenges that we see with this epidemic continue to evolve and grow. Just last week, I met with the Drug Enforcement Agency in New Hampshire, a number of hardworking and brave men and women on the front lines. We discussed not only the heroin and fentanyl issue, but the spread of the dangerous synthetic drug carfentanil, which is 100 times stronger than even fentanyl. I know all of us here today are ready to work with members of both parties to stem and ultimately reverse the tide of this crisis. We need more resources, as you've heard from my colleagues here, and as you will hear from families, physicians, treatment providers all across our country, to address this problem because people are dying. I'm grateful that the Trump administration has discussed the severity of this crisis, but their actions so far simply don't match their words. Trump Care would hurt hardworking people across New Hampshire and America, particularly harming efforts to combat the substance misuse crisis. As governor, I worked to pass and reauthorize New Hampshire's bipartisan Medicaid expansion plan, which includes coverage for substance use disorder and behavioral health services, which behavioral health issues often co-occur with substance use disorder. As you've heard, Trump Care, though, ends Medicaid expansion, which experts have said is the #1 tool we have to fight the substance misuse crisis. Trump Care also undermines the requirement that insurance companies have to cover mental health and substance use disorder services, taking us back to the time where people's hard-earned money that they use to pay for premiums won't cover the actual illness that they need treatment for. In the midst of this crisis, we need to be strengthening prevention, treatment, and recovery efforts. Pulling the rug out from those in the throes of addiction is unconscionable. I will add to these concerns my concern as well that we're also seeing a proposal for the Trump administration that would hurt our efforts to combat substance misuse on the supply side of the equation. The Trump administration has proposed effectively eliminating the Office of National Drug Control Policy. Slashing funding for that office isn't fiscally responsible. It is, in fact, dangerous. The office helps coordinate response and set policy across the federal government, and it administers critical grant funding for the states. I've joined Senator Shaheen in introducing the Office of National Drug Control Policy Reauthorization Act, which, as you heard, reauthorizes and expands that office and critical programs such as the high-intensity drug trafficking program. It makes clear that to the administration that we will not tolerate reckless cuts that would hurt our ability to support those on the front lines. I am always reminded whenever I meet with law enforcement that they, as well as treatment providers, have a unique and important message for the rest of us, which is we will not arrest our way out of this crisis. There is a supply issue, to be sure, but there is also a demand issue. The United States of America consumes over 80% of the world's opiates. We have to get at this issue from a variety of different perspectives, and that's exactly why we need the Office of National Drug Control Policy to help coordinate these efforts. This is a time when interdisciplinary action and coordinated efforts means even more than it ever has, and it is absolutely essential that we work to support and maintain what's in the Affordable Care Act that is so critical to fighting this crisis on the demand side, and that we continue to work with law enforcement to make sure that we're doing everything we can to have a coordinated response on the supply side as well. Thank you.
Thank you all very much. I think we'd be happy to answer any questions you have. Yes.
Two questions. So first, as you mentioned, this is something that President Trump on the campaign trail raised repeatedly. I'm just curious, you know, to the extent you know, or what do you think's going on here? Do you think it's a matter of him not knowing how the House bill would affect the opioid problem, or just making promises for political expediency? And then secondly, I'd be remiss if I didn't ask you all to weigh in on this report about the president sharing highly classified information with Russians.
Well, with respect to the president's motivation, I wouldn't presume to assign a motivation to the president. I can tell you that the quote that I used is no longer available on his website. So it seems to me that despite the promises that were made to people in New Hampshire, that at least so far, he's not fulfilling those promises. Others may wish to address that, but I will address the question about the intelligence sharing briefly. And I'm very concerned about that as a member of both the Armed Services and Foreign Relations Committees, both in terms of what the Russians might be able to discern based on what was said to them in that meeting. I think we should have a classified briefing for members of the Senate to let us know what was shared. But I'm also concerned about the impact long-term on our allies who share intelligence with us, as well as on the intelligence community here in America, and what it means for them going forward. Anyone else want to?
Basically, the Republicans have a very simple plan. By cutting Medicaid by $880 billion, they create the funding source for their tax break for the wealthiest people in America. That's the plan. Cut the programs for the poorest people, cut the programs for the middle class, cut the programs for those who need addiction treatment or veterans or maternal care, and then put all that money in one pile and then have a tax bill which gives a tax break. That's their plan. It's very simple, not complicated. And it is at the heart of the Republican playbook. So that's what this is really all about. With regard to the compromise of code-worded information, it compromises our intelligence sources, it compromises our war against ISIS, it compromises our relationship with other international partners, and potentially, because of the way in which this was revealed, it potentially compromises our young men and women over in the Middle East who are fighting for us. So that's why it's such a serious issue, and that's why the president has to give the full story to the American people about what this conversation with the Russian ambassador and foreign minister actually entailed.
On your first question, the one thing I want to add to the discussion, again, bringing it back to Trump Care 2.0, is the president on the campaign trail also promised insurance for everyone. And we know that this measure that was passed by the House is a severe step backwards. I am one who has been lifted and heartened by the involvement of literally tens of thousands of Wisconsinites and hundreds of thousands, if not millions, of Americans sharing publicly how this bill would impact them in many, many ways. I'm particularly proud of those from families who have been affected by substance abuse, the opioid epidemic, heroin overdose, for having the courage to step out and talk about the impact that this measure would have on themselves and on others in the future. And in fighting this Trump Care 2.0, it is going to involve not just senators, but a very healthy involvement from the American public. On the disclosures, I am shocked, and it's hard to put in words the level of irresponsibility here. Russia is an adversary. Russia is a hostile power. The idea not only of disclosure of information at this level of classification, but to whom, is more than troubling. And I know that we are perhaps prompted by Comey's firing, not by the disclosures in the newspaper of last night, going to have a chance to speak with a number of individuals who hopefully can inform us of just how bad the damage is right now.
And I guess I would, to your first question, just speak of one example, which is the example of Ashley Hurto from New Hampshire, who actually came here to the Capitol to listen to the president's congressional address. Ashley was addicted. After losing her husband to an overdose, she sought treatment. The treatment was possible for her because she qualified for Medicaid expansion. She got treatment. She has been well now. She actually transitioned off of Medicaid expansion. She got a job and got her insurance through her employer. Exactly what we want to have happen. We want health insurance to help people get better so that they can work and they can then support themselves and buy their own health insurance. That's exactly what Medicaid expansion did for this young woman who was suffering from addiction. The American people and the people in New Hampshire can connect these dots. And what we're really here to do is to urge the Trump administration to connect the dots themselves and understand the way policy really impacts real people's lives. And as to the second question, I would just add my shock, my outrage. I agree that we should have a classified briefing so senators know what was shared with the Russians. I am very concerned that this ultimately makes us less safe.
Thank you all very much.